I'm Mr. Sharma. I'm a consultant orthopedic surgeon. I do shoulders, elbows, wrist and hand. Tennis elbow, as the name says, it came from tennis players when the name was coined. And there's a particular backhand tennis stroke that leads to a lot of stress on the outside of the elbow. So when you grip your hand on a tennis racket and you give a backhand, the muscles that hold the wrist and take the pressure, they all start from the top of this elbow on the outside, and they get a lot of stress and strain. So when that starts hurting, so any pain that leads to pain around the elbow is called tennis elbow. The symptoms of tennis elbow are that of pain on gripping, lifting something, and it could be quite debilitating because you lose a bit of grip strength and you wouldn't be able to do things like opening a jam jar, a new one, where you need a lot of power to grip and try to do that rotating action, or trying to lift a suitcase, etc. So these cause a lot of pain at the outside of the elbow. First cause is unknown. You can get it for no reason whatsoever by daily activity, but the commonly known reasons are that you suddenly go to the gym and you start doing, say, for instance, rowing or lifting weights, and the pulling action can lead to a lot of strain there. Also, it could be at work when you're continuously doing repetitive work when lifting something and you've not warmed up, or the tendon has had more pressure on it than normal. That can lead to pain there. People have also said that when they come back from a holiday, they get off the flight, they go to the carousel to pick up the luggage, and the sudden pulling sensation from a rested body, that can lead to it. And there's several such reasons that can cause tennis elbow. The best treatment for tennis elbow is to catch it early. You go to your doctor, and the initial treatment is to give a little bit of rest, a bit of physiotherapy. Best initial treatment is like acupuncture. The physiotherapist would do ultrasound massage, strengthening the tendon, taking anti-inflammatories. This would be the initial treatment. If the person attends within the first 6 weeks of the problem and it's not gotten better with physiotherapy or acupuncture, etc., then people consider giving various forms of injections. The most common injection that has been given in the past, and even now, is this injection of steroid or a cortisone injection. And given appropriately at the beginning, can give a good relief. However, nowadays we've got a new injection that has come out for the last 10 years or so. It's called PRP. It's called platelet-rich plasma, in which one draws blood from the patient, spins it before it clots, creates a separate layer of the red blood cells and the white cells going down, leaving platelets in the serum. And that is injected back with the understanding that that creates a reaction and a healing response. So these are the two kind of initial treatments. If they all fail, then the last resort is surgical intervention, which can be done through the keyhole or open procedure. They're not always the best options, and it's usually done for chronic conditions where symptoms have not gotten better over several months with other treatments. So once a decision has been made to give an injection for tennis elbow, it can be done as an outpatient procedure. So assuming we give a steroid injection, so the risks of the injection are always discussed, which are quite minimal. One is you can get an infection, like with any other injection. You can get a bit of a white spot on the skin because cortisone can cause that. The recovery is fairly instant. I mean, you feel a lot better because there's local anesthetic, so the pain goes away. You feel a lot better for the first few hours. And the injection, cortisone, takes about 2 to 3 days to make an effect and make you feel a lot better. There are no restrictions after that. But if you went with the PRP injection, that doesn't give instant relief. It's a bit of a painful injection, but it does do wonders if it starts healing the tendon quite quickly and taking the inflammation down. Yes, it can reoccur. It doesn't always, it's not always curative, because most of the patients will come quite late after several months, 3 to 6 months, and then giving an injection can improve the symptoms in the short term, but doesn't always affect a cure. Hence the message that get the initial treatment if it is an injection within the first 6 weeks if possible. Recovery time takes quite long actually, because once you've operated, you do need the tendon that has been debrided, and sometimes even the bone has to be trimmed. Now, that takes a good 6 to 8 weeks for it to heal well. But in that meantime, one does physiotherapy. So initial recovery from the operation is fairly instant. I mean, you could go back to your office, etc., within about a week or 10 days once the wound is healed. But to be able to get back to sporting and regular physical activity can take almost up to 3 months. The problems can reoccur, and hence the surgery for tennis elbow is not the most popular, because not always everybody gets the desired result, and the success rate is approximately 70 to 80%, so there are quite a large percentage that do not get the desired relief. Hence, to get it tackled early is quite important. It's important not to let it become a chronic problem. If somebody suspects that I've got tennis elbow, I think the initial treatment is to get some physiotherapy, and one can contact the Hatfield Hospital directly via the physiotherapist or the hospital reception that they'd like physiotherapy if your insurance company or your self-funding would like to come. Alternative route is to go to your general practitioner and see if they can assist. Sometimes we have general practitioners working at one Hatfield, and they could probably have a look at you as well. If you already had some treatment in the past and has not worked, then you could always seek out an upper limb consultant to take it to the next level, either going for an injection or maybe an investigation, perhaps an X-ray or an MRI if necessary, to see why is it not getting better after the conservative management. But a complete history and the reasons of whether you've got normal health issues, or some people have some rheumatic conditions, some people have diabetes, etc., and one has to make sure that one is fit before the treatment started. So it's good to get in touch with the GP or the doctor in the hospital straight away.